Anthem and Humana, two companies caught up in the healthcare consolidation wave, both reported better than expected earnings today. Anthem hiked its 2015 forecast, and Humana reported a 25% jump in profits. The stocks went in different directions, though, with Anthem rising and Humana falling. And with a third of Americans enrolled in Medicare and Medicaid, Bertha Coombs reports on just how dependent both these companies are on those government programs, which coincidentally turned 50 today.
Deep breath.
For Americans, Medicare has become a cherished entitlement. For politicians, the senior health plan's a sacred cow, while the Medicaid plan for the poor is sometimes more partisan.
We must not allow the promise of Medicare and Medicaid to be undermined or be betrayed.
For insurers, the government programs are now an important source of growth. In the last decade, the percentage of seniors buying private insurance plans for services not covered under Medicare has more than doubled, from 13% to 31%, while expansion under the Affordable Care Act has seen Medicaid add 14 million low-income Americans.
People with government health care, that number is growing, while the number of people with private insurance through their employer is starting to shrink a little bit. So it's a matter of which direction the numbers are shifting.
And that shift is helping the bottom lines of firms in the government healthcare sector. The nation's second largest health insurer, Anthem, reported second quarter profits above estimates after adding nearly 1 million new Medicaid customers. Through its proposed acquisition of Cigna, Anthem hopes to grow their combined Medicare business. Humana, which has agreed to be acquired by Aetna, posted results slightly higher than expected, though the Medicare giant's patients have been using more medical treatments, pressuring its profits. Slim margins on government plans leave less room for error than employer coverage, says Cece Connolly. And then there's political risk.
When the economy gets tight and the politicians are looking to balance a budget, that's a natural pot of money. They're big pots of money they look to squeeze down.
But as George Washington University professor Len Nichols points out, with insurers more involved in government health care, Medicare and Medicaid patients now have a voice with big business to push back when funding cuts are threatened. Bertha Coombs, Nightly Business Report, Washington.